all red light beds are not equivalent to each other, right? There are a lot of facilities out there that actually have red light therapy equipment or beds, or even those stand-up pods that don't have the same wavelengths that we do. We have 5 different wavelengths in our red light therapy at Scape.
5.
Okay. One is so basically there are 2 in the red light range, and that's 630 and 660 nanometers wavelength, right? And what those really target is more of the superficial aspects, like aesthetic, through the skin, because it will probably penetrate between 1 to 1.5 millimeter into the skin. So you're probably hitting more the epidermal area. So areas you probably heard some of the publications or even read them about potential treatment of like fine lines on the skin and aging.
That's why I'm here. My aging eyes.
Yeah, and it actually produces collagen production. So it's a large amount of collagen production. So that's one of the reasons why it boosts collagen production, and that's how it helps with, aesthetic purposes. Again, our red light therapy beds, even though it says red light, it actually also has the near infrared wavelength, which is in the 800 range. The 800 range that we have is about 810, which is targeted to connective tissue. And the way that wavelength works is that it's narrow, but it's actually a lot deeper. So it goes straight down to connective tissue, and that's easily at least 5 millimeters passes the epidermis, the dermis, the subcutaneous, and even goes down to the nerves. So that's one of the reasons why the 800 range, which we also have the 850, can target like pain relief, inflammation reduction, even cellular and tissue repair, and improve blood circulation, because it's actually going all the way deep into the nerves, possibly even your lymphatic vessels, and then your veins and your arteries. So that's why it really does help with that. And then in Scape, we have beds that are 21,600 LED lights at 5 different wavelengths. So the thing is that you have to look at 3 different things about red light. One is the wavelengths. Does it have the correct wavelengths? Because some people go into thinking that they're going to get some kind of inflammation reduction, but they just realize that the red light modality that they're utilizing, like whether it's a lamp, doesn't have that. It doesn't have the 800 range, it only has the 600 range. So it's really not going to target inflammation reduction or pain relief or cellular tissue repair. But if they're only using it for aesthetic purposes, then the 600 range is fine.
Gotcha.
And then the second part is power density, right? Now, power density is basically power, the way it's measured is milliwatts per centimeter squared. It's the penetration. So if our beds are literally right next to your skin, so it's going to have to travel a lot less and penetrate further more effectively than if it was probably 1 foot away or 2 feet away, because it has to travel that. And what happens with light is that it tends to disperse or diminish with distance, right? And then the last one is dose. And you have to think about the frequency, if not the duration. Like, so if you're going to do incremental periods of only 10 minutes, then maybe you want to increase the, in frequency, or if you increase the duration, then you can decrease the frequency, kind of thing. So with all those 3 aspects, if you just kind of put all 3 and account for it, you'll get that optimal dose that you're really looking for.